Thank you, Gerlach. I'm very grateful to have an opportunity to speak on this bill tonight in the House. I think tonight we take another firm step towards what this government has set out to do and what we campaigned to do in the last general election, which was abolish the HSE. But as my colleague Deputy English has said, what you can't do is the populist thing that we all would have a desire to do, and I think the public would love to see happen in one instance, which is just abolish the HSE in the morning and just leave a vacuum there. The abolition and the untangling of the bureaucratic mess that is the HSE has to be done in stages, it has to be done in steps, it has to be done in a logical manner over time. And that's exactly what Minister Riley has set out to do. And I think so many people, both in this House and indeed in the media, are so used to Ministers for Health failing and Ministers for Health not delivering from successive governments that people have been ready to jump on every possible criticism of Minister Riley and say he's not delivering. Tonight, we have concrete evidence of yet a further step taken by the Minister for Health and by this Fine Gael Labour government towards the abolition of the HSE, but more crucially than that, towards the abolition of the HSE and the replacement of that bureaucratic monster with a system of directorates that prioritise the areas of importance to us in relation to health. I mean, I remember a former Minister for Health, a former leader of the Progressive Democrats, referring to the catastrophe in the HSE. Oh, that would just be a 9-day wonder. It would all be over. Well, it's been a very long 9 days for the Irish people, and it's been a very expensive 9 days, because what we have seen is we have seen phrases be attached in the public mind and be attached in reality to the HSE. Phrases like can't get answers, black hole, lack of transparency, no accountability. We've seen Deputy Martin, when he was the Minister for Health, attended an Oireachtas Health Committee where my former constituency colleague in Wicklow, then Deputy Liz McManus, asked, are you saying you're not responsible? And he shrugged his shoulders and said, well, I'm not. We all remember that. And I think that image has personified what has been the lack of accountability at a political level in the delivery of our public health service. As a member of the Public Accounts Committee, still now to this day, we see a situation where our health service has multiple financial systems, all operating on a different basis, systems not talking to each other. You ask what seems to be a relatively simple question at the Public Accounts Committee, and officials from the HSE don't answer it. And it's not that they don't answer it out of badness or out of trying to hide information. They don't answer it because all too often the information doesn't exist. I remember asking how many people are earning increments above a certain level, and it took weeks for the HSE to even establish it because the systems weren't actually in place. So I think anything that we can do to untangle and replace the HSE with a new structure is vital and a very welcome step. I also think it's important to note that our health service isn't just about hospitals and trolley counts. And we all fall into this trap, and the media fall into this trap, about A&E departments. You know, A&E is a very important part. Our hospitals, our acute hospitals, play a very important function, and the Minister for Health has had success in this regard. But our health service is about so much more than just hospitals, and I'm pleased to see that the new directorates that will be set up in our new health service recognise this. We will have a director for hospital care, for primary care, for mental health. We'll have a new child and family agency, social care, public health. And this is what we need to see, because we need to look at having people treated in their communities. We need to look at primary care. We need to look at health on a much more holistic level than just looking at health as somewhere you end up in an A&E department when you get very, very sick. And I think that the development of a new child and family agency to prioritise child protection is so important. We know of so many instances where the HSE at board meetings didn't even discuss the issue of child protection. It didn't even appear on agendas of board meetings of the HSE, at the same time that we know there were so many failings in our child protection systems. And I think having a new agency with a new director with the specific and sole purpose of looking out for child protection and child welfare has to be a very welcome development. And it sends a message from this Oireachtas and from this government that when we have a children's referendum, it's more than just a referendum, it's more than just a box-ticking exercise, that it's being backed up with real and substantive policy change. The issue of mental health, I really welcome the fact that we'll have a new directorate specifically empowered in the area of mental health. But I do have to say that it's been extremely disappointing that this House, that the government through its budget could propose to ring-fence €35 million, that this Oireachtas would vote that resolution through, that the Minister of State with responsibility would stand in very good faith on the front benches of this side of the House and tell me during a topical debate that she had the money in her back pocket, and then that HSE officials, unelected officials, would manage to siphon that off and put it somewhere where the Minister didn't want it to be, where the government didn't intend it to be, and where the Oireachtas didn't vote it to be. And, you know, if we're really serious about real health reform and real political accountability, when this House takes a decision, When the government puts forward a proposal that's accepted, when a minister directs something to happen, we cannot have a situation where a bureaucratic structure can allow anything else to happen. And I'm delighted to see Minister Lynch's work on this and trying to get back this money and send out a very clear message that when we ring-fence 35 million, and this was an issue on which there was cross-party support, when we ring-fence that 35 million, it should be spent in mental health services. Finally, I just would like to very much welcome the fact that this reforming bill and this HSE governance bill is an important step towards the rollout of free GP care. I'd like to compliment new Minister of State Alex White for his comments in relation to his intention to begin the process of rolling out free GP care this year. I think himself and the Minister for Health are to be commended for this. I also look forward to the continued development of primary care centres. I know there's a new one due to go to construction in my hometown of Greystones next month. And the very final note, though, I would leave, when we're talking about the health service, and in fact when we're talking about public sector reform in general, we have to stop talking about it with unions and national politicians and ignoring the people that actually know how to reform these services, the people that actually know where the savings are and the people that actually know how to make the structures better. And they're the people working in the health service. And I would appeal to the government and indeed to all of us involved in political life. Yes, let's have our national talks with union leaders and national politicians and have doorsteps and 6-1 news coverage. But let's also talk to the nurse on the ward. Let's talk to the dentist working in the primary care centre. And let's ask them, how do they see opportunities to save money? What do they see in terms of waste? How would they run services, more importantly? Because in all the discussion we've had about public sector reform, I think that's the element that's been missing.
Thank you.